All right, so now we are on beta blockers. These are OLOLs. Okay, so at the end or the suffix of medication names for this particular class, you will see OLOL, which will help you differentiate that this is a beta adrenergic blocker. Okay, it's an antagonist because it blocks. All right. So when we say beta adrenergic blocker, right? When we're referring to adrenergic, an adrenergic works on adrenaline. I cannot talk today, sorry. Adrenaline or epinephrine, norepinephrine. Okay. So beta adrenergic blocker. So it's blocking the effects of adrenaline or epi or norepinephrine. Okay. Which is going to stimulate some cardiac activity. But we're blocking that. Okay, so mechanism of action. It binds to and blocks beta 1. So beta 1, let's go to a slide really quick. This is good. Okay, so beta 1, these are primarily located on the surface of the heart, okay? Beta 1 receptors, that's where they're located. Beta 2 receptors are primarily located on the smooth muscles of the bronchioles, and then blood vessels that are found in like arteries of skeletal muscles too. But you see primarily beta 2 in the lungs, on the bronchioles, okay? So know that when we talk about beta 1, we're referring to the heart. Beta 2, we're referring to receptors of the lungs, okay? We have different types of beta adrenergic blockers, and some of them are what's called cardioselective, and some of them are non-selective. And then just let me scroll here really quick. So this is a really good picture too that will help you remember before we get too far ahead. Is beta 1 affects the heart, beta 2 affects the lungs. Okay, so I would always think of this picture in my head whenever I'm trying to differentiate these. Okay, so back to what I was saying, cardioselective. If I'm saying it is a beta adrenergic blocker that is cardioselective, I'm saying that it binds to and blocks beta 1 receptors in our heart's electrical conduction system. Okay, if it's binding to and blocking beta 1 receptors in our electrical conduction system, it's going to affect the heart rate. So beta adrenergic blockers decrease heart rate because it works on that conduction system. Okay. If I say it's a non-selective, and you need to know the difference between the two. Okay. If I say it's a non-selective beta adrenergic blocker, what I'm saying is it binds to and blocks beta 1 and beta 2 receptors in the heart, lungs, and systemically. Okay. Okay, so because it's non-selective and it's going to affect beta 1 and beta 2 receptors, which we know beta 2 consists of the lungs and systemically, right? Beta 1 is heart. We have to be really careful and cautious about using this in patients that have any type of known pulmonary diseases or illness, okay? What happens is this particular drug class can cause vasodilation, right? Which can be great, right? Because it's going to help lower blood pressure. But it also will cause bronchial constriction. So think if we're blocking beta 2 receptors, what if the patient is on medication that is specifically for a pulmonary disease, right? To help with their lungs. But if we're giving them something that is non-selective and affects those beta 2 receptors, that medication might not work as effectively. And we could cause bronchial constriction, right? We need our bronchioles nice and open so we have a nice patent airway, okay? And then also it will decrease renin secretion. And so remember, where does renin come from? Renin comes from the kidneys, and it stimulates basically that ROS system where we actually have the conversion of angiotensinogen that converts to ACE1 to ACE2, and then so on and so forth throughout the ROS process. Therapeutic effects. So therapeutically, you really want to remember what's happening here with this particular class of drug, okay? We are decreasing blood pressure. That's ultimately we want to achieve, right? So if we decrease blood pressure, we're decreasing constriction, we're decreasing resistance, we're decreasing afterload. You've seen all that already, okay? What's different is that this particular drug works on the heart's electrical conduction system, right? So if it's working on that conduction system, this particular class is going to decrease the heart rate. So what happens is we have a decrease of that sinoatrial node firing. Remember, that's our SA node, our pacemaker of the heart. Okay, so we call this as a negative chronotrope. Anything that's going to decrease the heart rate and works on that SA node is called a negative chronotrope. So how I try to remember this is chronotrope starts with the letter C, right? Negative chronotrope, okay? Chronotrope C, conduction system also starts with C. So I know that anything that is a chronotrope works on the conduction system of the heart, the electrical conduction system. It's going to affect the heart rate. So it could be a positive chronotrope or a negative chronotrope. So if it was positive, it's going to speed up the heart rate. If it's negative, it's going to slow the heart rate down. So this is a negative chronotrope. So beta blockers are going to decrease the blood pressure, but also decrease the heart rate. That's different than any of the classes that we've talked about so far. So when we're going through these medications, you're going to see a lot of things that are very similar or the same, right? And you're like, oh my gosh, there's so much. How do I differentiate? Really, the biggest thing to remember, I feel that's easiest and a shorter list to try and memorize, are those things that make the medications different, not the same. What makes them different? So far what makes them different is how this particular class works on the electrical conduction system of the heart, okay? This drug also decreases myocardial contractility. So if we have decreased myocardial contractility, right? So that's the force of contraction of the heart. That's what we're talking about when I say that. We're going to decrease the oxygen requirements of those myocardial cells. Important to remember for this. Decreases myocardial contractility, decreases O2 requirements of the myocardial cells. So we call this a negative inotrope. Okay, so chronotrope, we're referring to the electrical conduction system, right? Whether it's negative or positive, so the heart rate's either faster or slower. When we're talking about an inotrope, we're talking about the force of contractility, okay? So if we decrease the force of contractility, the heart doesn't need as much oxygen, right? We decrease the O2 requirements of those cells. So this is a negative inotrope, okay? So chronotrope, electrical conduction, affects SA node firing. Inotrope is the force of contractility, either positive or negative, okay? So you need to remember the differences between those and these therapeutic effects that I'm talking about. Indications, well, we would give it for someone for high blood pressure, right? Hypertension. We could also give it for someone who has angina or chest pain, because why? It helps to decrease that O2 demand of the myocardium. So those heart cells don't need as much oxygen or don't have as much oxygen demand, and it helps alleviate the pain. Dysrhythmia, so if a patient had a particular type of cardiac rhythm disturbance, we can use it for that as well. And then also left ventricular systolic dysfunction. Okay, precautions. So for precautions, we have concurrent use of multiple drugs affecting the blood pressure, again, because we're going to increase those hypotensive effects. And then pulmonary disease or illness. So this would be for, remember, non-selective, right? So non-selective beta adrenergic blockers are going to have this particular effect. Why? Because it works on the beta 1 and beta 2 receptors. Beta 1 heart, beta 2 lungs, okay? Important to remember that. We could give it, precautions would also be heart failure. So again, if there's some cardiac dysrhythmias, we want to be really careful about that, because if it's a dysrhythmia that is a slow dysrhythmia, so like bradycardia, right? Bradycardia is a slow heart rate, less than 60. So if that heart rate is slow, we know the side effect of this particular drug is going to slow the heart rate and lower the blood pressure, though that's a problem, right? So that's a nursing judgment call if we go assess it, because you want to take a blood pressure and heart rate before you give any type of cardiac medication, right? So if we go assess the blood pressure and heart rate and we see that the heart rate is low and or the blood pressure is low, and we know on our heads, well, this drug is going to lower the heart rate and lower the blood pressure, nursing judgment call. Am I going to hold it? I think I am. And I'm going to call the provider and let them know what's going on and why I decided to hold it, and see if they want to change it to something else. It also can mask the evidence of hypoglycemia. So this would be someone with low blood sugar. So how it does this is it basically just blunts the beta effects that we have of adrenaline and other related substances. So If a patient were to have hypoglycemia, they might not experience the typical adrenergic warning symptoms, such as tremors and palpitations, because this particular drug class blocks that. So that's just a fun tidbit to know. Nothing you would need to know that for testing purposes, but it's something to keep in mind when you're medicating patients with these types of medications. Contraindications. So some pulmonary diseases and some cardiac dysrhythmias, which we pretty much already talked about. Side effects, congestive heart failure, and some cardiac dysrhythmias. Again, the bradycardia is the biggest one that you really want to watch for, because that's a slower heart rate and the drug's going to slow the heart rate down. So that would be bad. And then bronchospasms or bronchoconstriction. So this would be for your non-selective beta-adrenergic blockers, right? Because they actually affect the beta-2 receptors. So the patient could have dyspnea, meaning difficulty breathing or wheezing. And then just also another factor is the fatigue a patient could have. Depression and impotence is a big one with some of these medications for men. So for nursing actions, we have assessment. What are we going to assess? We're going to make sure that we're assessing the blood pressure, the patient's heart rate, right? Those are all very important. So we want to make sure we're checking their pulmonary status. So we're putting our stethoscope on their chest and listening to their breath sounds. And again, assessing that blood pressure and heart rate. And then we're also looking at I's and O's, right? Intake and output, daily weights, side effects. These are things that we always need to keep in mind with medications when we administer them. Physical assessment, cardiac pulmonary, there it is again. And then patient education is the same, okay? Talking about the side effects of the drugs. They need to know, in particular, what's different about this is, if you saw in the other classes that we talked about thus far, they need to know how to monitor their own blood pressure. That is the same for this particular class. But what also is important, because we know it lowers the heart rate, is a patient needs to know how to check their heart rate, right? So they need to know what's a normal heart rate and how do I feel for a pulse and check it, okay? Those are educational points that you want to remember for this particular class. Other drugs which may interact possibly, again, hypotensive or even hypertensive symptoms if the medication is not working. Renal function, in terms of education, it's just the provider might happen to order, check their renal function every so often. It's not like they need to know what are normal renal function values. And then symptoms related to serum blood glucose. So remember, it might blunt the effects of, if they were to be hypoglycemic, they might not know it or have the same symptoms, because that effect is actually blunted. So for examples of drugs in class, you're only going to be, again, it's the three medications that are starred here, or asterisks, or are prototypes. You have propranolol, metoprolol, and atenolol. So you see olol is our suffix. That will tell you that this is a beta-adrenergic blocker. So to differentiate them, propranolol is a non-selective beta-adrenergic blocker, and then both metoprolol and atenolol are your selective beta-adrenergic blockers. So you know the difference between the three then. Okay, so